Hello, this PowerPoint presentation will briefly describe drug interactions and adverse reactions. Drug-to-drug interactions, these are interactions that can occur whenever a patient takes more than one drug. And we know that most individuals take more than one, many times several uh, drugs. Any of you that have worked in nursing homes can attest to the patient taking over 10 drugs a day easily. Some interactions are intended and desired, or they can be unintended and undesired. Patients frequently take more than one drug, multiple drugs to treat one disorder, especially with conditions like hypertension, diabetes. They may take more than one for a respiratory like asthma or COPD. They have multiple disorders, and especially with our geriatric populations, you're going to see more of diabetes, hypertension. They may have some COPD, arthritis, the list goes on. You have interactions with over-the-counter medications, um, with caffeine ingestion, with smoking, alcohol, and so on, illicit drug use, herbal preparations. So there can be pharmacokinetic reactions, interactions, where you have altered absorption, and that can be from an elevated gastric pH. It can be from laxatives, which increase the transit time, so decreases absorption. It can be from drugs that depress peristalsis, so that the drugs are not absorbed as they should be. From drugs that induce vomiting, therefore you don't get the drug at all or a decreased amount. You can have altered absorption from adsorbent drugs. You can have um, decreased altered absorption from drugs that reduce the regional blood flow to an area. You can also have altered distribution, and that's when you have competition for the protein binding, which we know is a very important process in order for um, drugs to enter the cells and cause the mechanisms of action that you're giving it for. And you can also have an alteration of the extracellular pH, which can affect the distribution. You can have altered renal excretion. Drugs can alter the filtration, the reabsorption, and the active secretion. And that's why for many drugs, if they have an effect on the renal system, that we do baseline labs and then labs periodically throughout the administration to make sure that the kidney function is still where we need it to be. Drug metabolism it can affect, and grapefruit is a huge one. Um, Not the other citrus juices, but just particularly grapefruit juice, and not the grapefruit. So grapefruit does not have the same effect as the juice. It can inhibit the metabolism of certain drugs and quite a few drugs actually. It can raise the blood levels of the drug. Um, so you must be careful in warning your patient, asking your patient if they drink grapefruit juice, and if they do, that they will need to stop that while they're on a certain medication. You also have to watch for certain drugs that cause a drug toxicity. So we know with our MAOIs that the tyramine containing foods, the hard cheeses, salamis, things like that can be fatal in some cases. And so those drugs are going to be prescribed, and those are used, of course, for depression mostly, that we educate our patients well, provide them with a list. Many times there is a pocket card that they can carry so they don't forget which medications or which beverages they are restricted from having at the time. And you can see here that there are other combinations that are important. Your theophylline with caffeine, um, your potassium sparing diuretics with salt substitutes, because the salt substitutes many times are high in potassium, so that the potassium levels could be too high, which could, of course, be detrimental from a cardiac standpoint. And then you have your aluminum containing antacids with the citrus beverages. Um, Again, affecting drug action, you have your warfarin with foods rich in vitamin K because it will affect the clotting, and then the timing. Some drugs are better tolerated on an empty stomach, while others should be taken with food, especially for nausea. You know, erythromycin is a big one that can be very irritating to the stomach. So you have to see whether um, you would advise to take with food. Um, for me, many of my meds we use, it really doesn't matter. So I tell the patient if it makes you nauseous, then have a little bit to eat with it, but otherwise you do not have to eat with it. For some drugs, it's better on an empty stomach because the food will slow down the absorption. Uh, just in general, so that you'd rather the med be absorbed quickly. One example of that would be like your levothyroxine. It should be taken on an empty stomach 30 minutes before you're going to eat anything in the morning. I am personally on that, so I have that right by the bed. And as soon as I wake up and go to get up, I take it so that while I'm initially getting up and getting ready, I've got that 30-minute leeway in case I want to have something to eat um, after I'm all ready to go. And then, of course, you have the drug herb interactions. And your conventional drugs can interact with herbal preparations. Um, they are just as likely as they are with prescription medications. So you need to make sure that you have a reliable source for the drug herb interactions as you can. We don't have a big resource for that, but there are some out there that are pretty good. When you attend conferences, and be sure and visit the vendors that are there, um, Mosby or one of the other Saunders, and see if they have books on herbal preparations because they are handy, they are helpful. And it's always important too to ask your patient if they're taking any herbal preparations, if they're getting and where they're getting those from. I've worked places where patients are getting them with the swap meet. Some patients are going down to Mexico and bringing back preparations. And it's not always that you have to tell them to stop, but you do need to be aware of what they are and warn the patient if there's any interactions with them. One of the big ones that we do know of is with the St. John's wort. Um, it can reduce the blood levels of many other drugs. Plus, it is also because it contains the it produces helps the body produce serotonin, like the prescription meds. They should not be taken with prescription medications for the same for depression because it could cause a patient to have a level of serotonin that could be dangerous.